Dr. Mohamed Jalloh, is directly supervising the Health Ministry, a responsibility delegated to him by President Julius Maada Bio. He cited that when they assumed office in 2018, budgetary allocation to the health sector was around 6%, but has now been increased to over 11%. However, there are still challenges, like he found out at the Oladurin Children's Hospital.
Essentially, it's overcrowding first. Because of the kind of facilities they have here, because of the kind of quality care they give, like Dr. Bell just said, a lot of people come here. So pregnant women, this is the major referral hospital for pediatrics. They take cases outside of the Western area. Even we went to the special unit where under 5 kids are treated with cancer. We still have patients there that come from other countries to here. So because of overcrowding, because people are coming here for the best of service, you have limited beds, particularly in the pediatric wards, and also when we visited the special baby care unit that was supposed to house 35 beds, there were more young kids there.
The hospital has a bed capacity of 165, but they are currently housing 200 patients. Acting Medical Superintendent Dr. Abubakar Ba highlighted another reason for the overcrowding and one key essential the infirmary is lacking.
Currently, because of the free healthcare initiative, we're having more patients than we used to have before, which can be seasonal. Yes, so we actually need more infrastructure. We need to expand on the buildings as well as the human resources.
Dr. Juldeh admitted that even though the government is yet to achieve the targets of the Abuja Declaration, which says all African countries must spend at least 15% of its national budget on health care, but progress has been made with the over 11% GDP investments in the health sector so far.
When you come to hospital, you have a clear understanding of the intervention you make at the policy level, what are the outcomes at the operational level. So I came here and I see that a lot of progress has taken place. I was even very impressed when Dr. Bell told me that the ICU units they have for under 5 is so developed that even people come from all over the place to utilize that facility. We also visited the special baby care unit, and I remember in 2019 when I visited the special baby care unit in Makeni in the Bombalidi street. That time baby care unit were just limited to regional outfits, so you had 4 up country. So I made a special appeal to UNICEF to expand that to the district level. We are very happy that in every district today in this country you have a special baby care unit. So what does that mean? It means premature born babies with very critical conditions, they have now 80% chances of surviving, unlike before where they have only 20%. I also visited the labor ward, and then the lab here in Oladurin. We see that they are making a transition, from manual to automated lab system. The lab technicians are very excited about that. We also visited the blood bank. We see that the equipment, like Dr. Bled said, they are very satisfied.
What could be done in response to the challenges highlighted?
These are challenges that as a government we have to look into and we have to address. So from here, I'm going to have a meeting with all the health superintendents, the doctors, the management staff, and the matron at the conference room, so that we can discuss in detail some of these challenges and see what we can address in the medium term, in the immediate term, in the medium term, and in the long term.
Salivu Charna Kamara, AYV News.